a lot of people can deal with hormone issues, but especially women when it comes to mold. When you're looking at gut issues, mold can colonize in the gut and lead to a lot of food sensitivities, allergies, that leaky gut, creating the environment for parasites to be there and H. pylori to overgrow and candida to overgrow.
Hey guys, thanks so much for tuning in to the first Optimal podcast. Really excited today. We have Alyssa, the Biohacking Bombshell, joining us. So she coming to us from the great state of Missouri. So, which is exciting. I don't know that I've had someone on from Missouri. So we're just covering so much ground here.
Bringing the Midwest to you today.
There you go. There you go. And as a fellow Midwesterner here in Michigan, it'll be exciting. So, but yeah, so with Alyssa, integrative health practitioner, she knows a lot about a lot. Really excited to get into this one. We're going to talk about different things from, toxicities, molds, believe it a little bit, just so many different things from how the body works and how some of these external factors can throw off one's body. I'm sure there's going to be a combination of natural things practical people can do, as well as, testing, or how would one know if they have any of these issues. So, but before we get into all that, we want to get to know you a little bit. So Alyssa, talk to us about, how did you get to where you are today? And for those who don't know this, and we'll get into it throughout the episode, I really like to ask this question, especially someone like yourself, because you've went super detailed and some really complex topics, and you're able to put it in really, really palatable, great short form content. So definitely can't encourage enough. We'll get to it more later in the show, but for people out there to give you a follow and check it out. But all that being said, that's my long-winded intro for you today. But you gotta let us know, how did you get here? So where did this come from?
Yeah. So I've always been into the health space, but honestly, my dad got diagnosed very young with lymphoma. I think around 8 years old. And so that was my first exposure to the fact that real health issues happen. And I started to take my health more seriously, and it became a little bit more like interwoven into our family practices. But then I started to deal with my own health issues from the time that I was little. I had gut issues, and then I ended up having, hormone imbalances in my teenage years. When I got into college, I got extreme chronic fatigue and brain fog. I was diagnosed with Lyme disease. And then later down the line, as I learned what I now know as an integrative health practitioner, I realized I had all of these other components like mold exposure, high environmental and industrial toxin exposure from different areas in life. And that created the perfect environment for things like Lyme disease and parasites and a lot of other co-infections. So it was out of need. Like, that's how I got where I am. And I feel like that is a lot of times a really common story with practitioners. You had to become your own best practitioner because you were really stuck with whoever you were seeing at that time and the information that you had. And it was really a survival mechanism to learn more and then acquire the knowledge to become the practitioner in the first place. So my own journey with chronic health challenges for several decades is what got me here.
Yeah, no, and I appreciate you sharing that as kind of an intro, because I mean, there's just so many things I want to get into. Definitely the mold thing, because we actually have a minor little mold issue here. So when my wife listens to this, we may be fixing it a little faster, faster than I originally intended.
You're welcome.
As my brain drifts thinking of post-production here. But no, I mean, it's always sad or unfortunate when someone is hit with these type of diagnoses or these type of issues. However, I find it more impactful and or a deeper rooted content and or information when the person actually went through it. Certainly there's good practitioners out there that maybe are not dealing with every single situation or condition they're treating. However, I've been really blessed to have some amazing guests, you being one of them, on the show that also have, not only dedicated their professional life and education to learning this stuff, because it is nuanced, it's very detailed. It requires a lot of attention and care that sometimes, the sick care model doesn't really have the time or resources to deep dive and investigate for people, coupled with oh, I felt that way. I remember I did this personally, or I worked with this client that did this personally, and this is the outcome we've seen, as well as here's what the data says, and so on. So I like it when there's someone who has personal experience, clinical application experience, and then they also have the knowledge, which is hard to obtain with the
Yes.
research and the data of what's out there. And some of that's maybe not fully vetted out all the time. And so as practitioners, you have to be nimble and kind of adjust as science adjusts. But how is that your journey kind of helped with your practical application of your therapies and treatments that you do?
Yeah. Well, I had a lot of health challenges to different severities since as far back as I can remember, but I remember taking my first stool test when I was 5 years old. And so going through as a child and then teenage years and early 20s, I would have people in my life say to me, gosh, you're so young. You should not be this sick. And I'm like, thank you, Sherlock. I know that. It's so hard to know that that's the case. But, as a Christian and being very rooted in my faith, I do truly believe and had leaned on it the entire time as I was going through my journey, that ultimately, I very humbly say, I just feel like God was using me as a tool to very early on deal with a lot of the challenges that many people may not deal with until their later 30s, 40s, 50s, 60s. As we age, I dealt with a lot of those things very early on. And I believe it was insanely hard, but it was a gift because I had learned at an accelerated rate how to help people in a way that a lot of times until you're decades and decades into life, you don't experience those things. So I had a quick education that was very painful, but it allowed me to help more people.
Yeah, no, and I appreciate you sharing that, because I know it's your faith is, the first thing, which I commend you for in your Instagram profile. And I think, other people have different faiths and things. It doesn't mean they can't work with someone of faith. But I think for those who don't know, my wife and I, Amber, like we started First Optimal mainly because of our faith was a big reason. But the episode's not about us, so I won't get into the details too much. But I think for those who maybe don't know, aren't familiar with the Christian faith, like we believe in do our work as if for the Lord, not for man. And so we're always so when someone does that, they're not accountable to worldly things. Like I'm not accountable to a boss or to an investor. Like I'm accountable to something, in my view. Maybe people think it's crazy and think it doesn't exist, and that's okay. Respect that. But my view is something much, much greater and higher that I'm accountable for. So I think it does allow you, it puts that healthy pressure on one, at least I've experienced this, to do your best, put towards that. And it's a little different level of accountability. I don't know. Have you experienced that with your faith being integrated into your work?
A different level of accountability, but also to really be able to view every challenge or gift in life differently. And I feel so blessed to be able to have God just place the correct people in my path. Like I truly believe that everyone that comes in contact with our clinic is placed there by God, because in some way, shape, or form, we're supposed to be helping them, or the people that find us on social media. And it's really beautiful to see that part of the healing process. I work with a lot of Christians. I also have worked with people who aren't quite sure what they believe in at all. I've worked with Muslims. I've worked with, all different types of faiths. So by no means, are we forcing that down anyone's throat, but to create a safe space for someone to make this part of their healing, the spiritual component is revolutionary as well. So that's the biggest impact. And that's why we also are vocal about that on social, because I feel like now more than ever, people are really starving for that. And I always say, like, don't get so caught up in the detoxes and the therapies and the protocols that your savior becomes secondary. That should be center. It's here. And no amount of nutrition and physical activity and supplements and detoxes is going to overpower not being aligned with where you need to be spiritually.
Yeah, no, that's a great point. I think a lot of the mental/spiritual part for some can get a little like, willy-nilly and little kind of like out there, but
It feels woo. Yes.
yeah, but it's there's definitely something. There's our human form, and then there's something else going on in there. And I think the more people can make that connection between, the mental, the spiritual, and the physical, as well as those external factors we're going to get into today with, molds and things that are causing issues, et cetera, or toxins and such, how those all kind of do interplay. And there's other things going on at work. And so I think I appreciate you sharing that. So that's good stuff.
Yeah.
I wanted to just to like unpack a little bit of this. So maybe we start with, I think you mentioned Lyme disease earlier. Was that your diagnosis or was that your dad's? I apologize.
That was mine. My dad's was lymphoma. So he got diagnosed with
Lymphoma.
cancer. Yeah.
Thank you. Thank you. Okay. So what can you walk through this high level? What is Lyme disease? How would one be diagnosed with that? Like what would be the reasoning for it?
Yes.
And let's kind of unpack that. Yeah, I appreciate that.
When it comes to Lyme disease and all the complexities, even the Lyme literate medical doctors out there, or LLMDs, are not extensively trained in all the components that go into what Lyme disease is. So it's created by a bacteria, the Borrelia bacteria. But the reality is, whether you have a bacterial infection or you're someone that has a viral infection like a herpes or EBV virus, even something like COVID, when you're looking at H. pylori overgrowth or candida overgrowth within the gut that cause a lot of gut issues, we have to ask ourselves, what is creating such an ideal environment for these things to overgrow? And one of the key things that are being missed with Lyme disease is actually mold and then parasites, which can hold on to Lyme bacteria. So that was actually a big component for me. Is I was diagnosed actually by a standard medical doctor. I got the typical Lyme blood test, which is also very flawed, but mine came back positive. I then was treated with 3 weeks worth of doxycycline, which is a very typical, antibiotic they're going to use there. And then I continued to have symptoms. So I went back and I'm like, I don't think this is gone. And from what I know from my research, I feel like we should have either done a longer round or there's some other component. I got totally gaslit. My GP literally told me, I'm pretty sure that this is just kind of all in our head. We're getting a little bit of this hypochondriac tendency, Alyssa, but if it'll make you feel better, I will test you again. And it came back positive. And I went to a chronic disease specialist and they were like, no, how they ran this wasn't right. You don't have it. And so I sat there like a lot of people with Lyme disease do, dealing with chronic fatigue and brain fog, and it was affecting my gut drastically. A lot of people will also deal with pain in addition with that. And I was lost for a while. And so it wasn't until I ended up going and seeing a functional medical doctor who was also a little bit Lyme literate, and then going and learning my own things through the Integrative Health Practitioner Institute, that I realized there were all of these other components that actually were creating the environment for Lyme to be an issue, and co-infections that went along with Lyme, which are a problem too.
And so was the end result that you did not have Lyme disease then and had something else, or what was?
That would depend on who you ask. Lyme disease is really tricky because the CDC has one type of testing, and then you end up having other companies out there that will do different types of urine tests or blood tests that are looking for IgM and IgG antibodies to see, does it look like it's more of an acute and immediate issue? Does it look like there is a more like chronic issue, or you did recently have it and we can see that the antibodies are still there from a previous exposure? And then you're going and looking at what ranges you look at. So it just depends on whose eyeballs are on it. But the standard medical doctors, chronic disease specialists, and a lot of Lyme literate medical doctors will still be looking at a lot of the old type of testing. So diagnostically, you can't look at a lot of these other tests and say, you have Lyme disease. When we are working with clients, we cannot run this test and say, you have Lyme, you have Babesia, you have whatever the bacterial viral issue is. But we can say, here is the response that your body has mounted. And here's often why that happens. So let's figure out what we want to address here.
Gotcha. And then just for those out there too, are there other ways other than like a tick-borne disease, as Lyme disease often is associated with? Are there other ways one can get it? Is it just tick? Like how does that come
There
about?
are definitely other studies out there that will show, and it kind of depends on who reads them and how you want to interpret it. And is it more like clinical versus like anecdotal, observational? It looks like there could be like a correlation here and we need more studies to confirm it. But we definitely know that parasites can harbor Lyme bacteria. They are known as the Trojan horse. They can harbor different viruses, release things over time, metals, all these other things. So think about the way that people pass parasites. Think about all the ways that happens, right? You can literally have, saliva and other vectors or pinworms come out the anus and into somebody else, or, you pick them up from there's so many different ways that you acquire parasites. Well, parasites can hold on to all these other things and transfer from one thing to another. is it possible that it's transferring like that?
Uh,
So that's a way. Mosquitoes are another projection, and some would even go so far to say that it could potentially be transferred through sex. That's probably the one that's a little bit more debatable and would need further study. But from mom to child, absolutely. So it could be just through birth. So yeah.
Gotcha. And then the other thing, just on the topic again, I'm a very novice to it. So there's some information out there about like a post-treatment Lyme disease syndrome. Is that like it wasn't killed off enough? Is it some of the havoc that it wreaked on the body after the fact? Like, are you familiar with that? Is that something? Are you usually seeing patients because they've already went the traditional route and they're still having symptoms? How does that play in?
Yeah, I mean, I have a good amount of clients that have seen a practitioner for what they thought was Lyme disease. And sometimes it was confirmed and sometimes it wasn't. And I was like, guarantee if we ended up running some antibody testing here, we would find it there, right? And then how active it is and how it's presenting and what the rest of the toxic load and pathogenic load looks like for the client. You know, two people can have Lyme present and one person seems really reactive and responsive and the other person may have the same amount of antibodies and no symptoms. That goes for a lot of different things. But a lot of people will come to us because they do hear my story about chronic fatigue and brain fog and other issues. And they may have gotten rounds of doxycycline or seen some of the top Lyme docs out there and spent 50 to 100 grand on treatments and still be stuck. Sometimes it is Lyme that is not fully eradicated, in my opinion, but the goal isn't to wipe out like all the bacteria and all the parasites. And I tell people that all the time. It's to bring down that load and look at the other stressors, the molds, the environmental toxins, the hidden dental infections, the scar tissue, the nervous system dysregulation that's creating the environment that is allowing an opportunistic infection like Lyme disease to be such a problem. Those are the things that typically aren't addressed, which is why people will chase Lyme and EBV and infections month after month, year after year, and not get better because it's these other components that are really the key players here. So both are relative.
Gotcha. And then for either your own experience or maybe a case study or a client, story better fills the answer to this question. Like what were and there's a lot of nuance. I'm going to paint with a broad brush here, but what were like some of the general, functional testing you do or ways that you assess it's working, it's not working? And then maybe if we can get into a little bit of some practical things that you've seen work with people that are showing some of these symptoms or issues.
Are you speaking a little bit more towards Lyme specifically or just chronic illness symptoms like this in general, as far as the type of labs that we run?
Yeah, I think what I'm going at is or similar to the symptoms you experience, because as you mentioned earlier, it depends on who you talk to if you had Lyme disease or not. So maybe keeping it more open-ended to what it is, but maybe if someone out there is listening to this and are having some of those same brain fog, chronic fatigue,
Yes.
the other symptoms you mentioned, what are some ways to either confirm or rule out or point them in that direction through testing, assessments, questionnaires,
Yes.
etc.? Like, what does that look like?
Yes. We have a lot of clients that are dealing with chronic fatigue and brain fog and a lot of the issues we just talked about. But say you go to Google or ChatGPT and you're saying that these are your symptoms, you have a plethora of different contributing root causes that come up, right? So if someone is entering into our clinic, we are not only doing a full assessment of their total case history and looking at all those other components from the time that they are born, to also doing up-to-date testing. So oftentimes we're doing a urinalysis of things like mycotoxins, mold toxins, heavy metals, environmental toxins, PFAS, forever chemicals. And then we're looking at that in conjunction with extensive functional medicine, blood work, and urinalysis that we'll often run at a place like LabCorp or Quest as well.
Sure.
If we feel like we want to add on some of these other extensive labs, there are hundreds of thousands of labs we could run, right? And millions of markers, and someone could spend their entire life savings just on getting data. So we're very selective and intentional about what we know brings the greatest value, the greatest bang for our buck. But if we wanted to go and do testing for a particular type of infections, we could do that. We typically start with overall toxic load, extensive blood work, which gives us a lot of root cause clues, and we see patterns of dysfunction, and look at that with case history to figure out what are the key players, and now what order do we want to go in to address these things. So we have to dial in on what exactly is causing the problem here. Some of that is evident through labs, and some of it has to be a discussion through case history.
Yeah, no, that makes sense. And when if you're taking this situation and, again, maybe just a high percentage of the time, I know there's going to be a lot of individual approaches here. What are some initial things you would initiate in someone? I guess maybe first, if we start in the body, like if they're having these issues, you're finding a higher toxic load. Are you focusing on like liver first? Are you focusing on gut? Is there a
Yeah.
certain, is it all of the above, or is there a certain like, hey, we do this in phase one, phase two,
Yeah.
phase three? Like, what does that look like for you?
Yeah. So essentially what you're asking about is kind of what the typical roadmap to healing looks like for clients, because
Mhm.
you can do a lot of the right things over time, but in the wrong order or for an inappropriate length of time. And that's what happened to me. That's what
Mhm.
also happens to a lot of our clients that come and say, I have spent tens of thousands, hundreds of thousands of dollars. I've seen 5, 10, 15 plus practitioners. I've done all the testing. How is this different? Why am I not better? What is going on? And a lot of times that's why. So when
Mhm.
someone is coming in, again, it can depend on what they've done up until this point, because we do want to pick up where someone has left off. Typically, we are starting with making sure that we get someone's drainage pathways open from the start before we push any type of more extensive detox, while also supporting the foundations. I'm not going and getting really nitty gritty about doing a liver flush with you and healing and sealing the gut and doing all this extensive detox if we're still eating like garbage, you're not prioritizing sleep, your water's still not filtered, and you're not drinking enough of it. And those are the boring basics, but I can't overpower that with supplements. And it's way more expensive for you in the long run. So we
Right.
do have to look at those pieces from the start to set the foundation. We get drainage open. And then often we're moving into doing some mold work and parasite work in the beginning. Then a lot of times we're transitioning more into the deeper heavy metal and environmental toxin work. And then a lot of times viruses and stealth infections are more towards the end. This is nuanced. It depends on the person.
Sure.
Sometimes we will change the order, but that's often the flow.
Yeah. No, no, that's helpful. And so, because for someone out there is like, well, how do I know if I have good drainage or not? Like,
Yeah.
how does one assess that?
First thing that I'll tell somebody is that there is a drainage funnel. So if you would ever go into my social media, I have 2 highlights on drainage and you'll see the funnel graphic. It's very helpful to visualize. But when you have the bowels that are at the bottom, and then the liver, and then like the kidneys and the lymph and the lungs that are backflow organs, and then when you have the lymph and the mitochondria more so towards the top, you start to realize like where you're going to see symptoms first. And typically it's going to be the bowels. If you're not pooping, you're not having good drainage, and that's the stopper for everything else. But you can definitely go up and say, okay, for the liver, if you're having pain or like dull aches or discomfort in the upper right quadrant of your abdomen, telltale sign of liver and gallbladder stagnancy. If you're feeling really puffy or swollen, lymph is probably backed up. If you have poor energy, poor capacity for recovery from exercise, mitochondria are probably tanked. If you have UTIs, if you have urinary tract infections or pain in your lower back, kidneys could be an issue. So that's why I created those highlights. And I actually have a free drainage clinic where we go extensively into each drainage pathway and say, here are the key symptoms that
Mm,
are associated with different types of drainage stagnancy. And that helps people to have an understanding of what to look out for, because it really does depend. But the biggest thing that I can say is if your bowels are not moving, you're not having at least 1 to 2 good full relieving bowel movements each day that feel like you're fully evacuating, if we're just being really real, it should be
right.
a good experience there. Then you can't worry about your lymph being backed up or your liver being backed up, because if your bowels aren't moving, nothing's moving.
Right. They're not gonna, yeah. No, that makes sense.
Yeah.
And then in that case, do you usually find is there a higher, let me rephrase this. So, well, like, what would be generally the culprit? Like, do you find that it's more not enough of something like fiber, hydration, etc., or and I'm sure it's a mixed bag. And
Yeah.
so answer it however you see fit. Or I
Yeah.
was gonna say, or is it too much of something, like too much inflammatory foods,
Yeah.
highly processed, whatever the case may be.
Yeah. Again, we talk about the causes of drainage stagnancy in that clinic as well for that reason. Because I love that you asked this question, because it's not just about saying, hey, how do I get my drainage pathways open and what can I take, or what enema can I do, or what castor oil pack can I do to get something moving? We have to ask ourselves, why is it stagnant in the first place?
Sure.
Because it didn't just get there like that. So when you're looking at the bowels specifically, hydration, of course, is a big one. Many people are not having enough fiber. If you're looking at 25 grams a day as the minimum, men tend to need higher. Most people aren't getting anywhere close to that.
No, yeah.
And then when you're looking at nervous system dysregulation or just being in a constant state or fight or flight, your body's typically not worried about pooping if you're in this sympathetic activation state. Some people may be the opposite. And I was like that as a kid. I was like a nervous Nelly, and then I had like IBS type of symptoms, right? So I'm going too much. I had more like the IBS D. I was on the looser side. But when you're looking at the components that most people have at the core, it is those lifestyle components of hydration, of the fiber, and having a nervous system that's a little all over the place. So they're just not feeling safe to go to the bathroom wherever they are.
Gotcha. Okay. Yeah, I thought we've mentioned your social media a couple times, so I think I want to transition to that a little bit and just pull up a few things just to get maybe a play-by-play from you on this. So for those listening in on audio, we're at Biohacking Bombshell, her Instagram, Alyssa's Instagram here. And my first one is 10 things I no longer do as a holistic practitioner.
Yes.
So I just thought maybe we could walk through some of these. So wear underwear to bed.
Yeah. So if you want the extensive explanations, we can definitely go through them here. But just for anyone that wants to be able to have it sent directly to them as well, we literally send over all of the breakdowns in detail in an email. So you could get that sent to you. And that's what we talk about in the caption of this reel that's pinned right to the top. You guys will see it right away when you're there. But wearing underwear to bed is actually something that contributes to a lot of my females, especially, that end up having more UTIs. They're dealing with chronic yeast infections that are within like the moist area there. So your vaginal area is trying to reset while you're sleeping. And as much as possible, if you could avoid wearing underwear at all, that'd be great. Most of us, for comfort levels and for other reasons, we do want to wear it during the day, but especially while you're sleeping, if you can let it breathe and be able to reset, not have a moist environment locked in there, keep a balanced pH, you will reduce the likelihood of infection in that area.
Gotcha. No, and we don't have to hit all of them, but for everybody, anyone who's listening on audio, wear underwear to bed, get a mammogram, brush your teeth after meals, sleep on top floors of a hotel, wash my face, get ice in my drink, buy coffee or tea at a coffee shop, drink liquids with meals, put lemon lime in my drink, use an air fryer. I was going to ask, because just the post, obviously you got a lot of engagement on the mammogram one. So it seemed to strike a chord with some people out there.
Of course. Of course.
What's the thought process, if you don't mind unpacking that one for us, or the reference there, or what brought you to that?
For sure. It's definitely something a lot of people are interested in. And I have a couple of different pieces of content on that, where in the caption, we talk about safer alternatives. So if anyone is curious about the different types of testing that you could use as an alternative, we don't just say, hey, don't get it, don't screen your breast. That's not what we're saying. It's that there are more accurate and valid ways of assessing than doing that. And really with breast in general, it should never be just one type of assessment. You really should pair them together, because everything has its own specialty. But when it comes to the fact that they say like mammograms save lives, and when you actually look at the Cochrane review, where they're looking at over a course of, I think it was about a decade there, while you may end up saving, maybe like 1 to 2 women's lives with the mammogram, the amount of women, around 20 or so, would go for that same sample group, would go and get a false negative and have unnecessary continued imaging, biopsies, or falsely be told that they had cancer when they didn't. The false negatives do not outweigh the one person that may be properly diagnosed. And the density of your breast tissue drastically affects whether you can see anything or not. So you have women constantly getting radiation on such a sensitive area. Dr. Jen Simmons is one of my favorite people that talks about this. She was a breast cancer surgeon. And when she realized the flaws within the system, she started to become very vocal about the fact that this was really broken. And she's doing, all these mastectomies on women that didn't need them. And so there's a lot of deeper conversation that we could go into there, but that's kind of the big bird's eye view of that type of conversation there.
So, and is there something that, someone's meeting with their practitioner that wants them to get one? Is there an alternate test that you feel is safer or less problematic that maybe they could have a conversation with their provider about?
You could, and if you want them specifically linked, like I said, in any of those posts, like we can send them straight to you so you guys don't get confused if you're trying to Google it. But there's something that you could either do like a breast ultrasound, which would be my top preference and alternative, and or looking at like what they call a QT scan, so it doesn't end up having radiation there. And there are a lot of facilities that start to do that as well. Looking at those in conjunction would be my preference.
Yeah.
Yeah.
No, that's great. That's a great point. Because like you said, sending over, all your information you have, and it's good for people to engage with it, to really understand what you're saying with that.
Yeah.
Right. Cause like, so, as you mentioned, like people, can jump at the first trigger, but it's like, no,
Yeah.
I'm saying do this instead, or these are other
Yeah.
alternatives. So
Absolutely. And the last thing I would want is for someone to kind of hear like a little bit in piece here and go into Google and type something, and Google scares them into being like, no, all you can do is a mammogram. Nothing else is reliable. So that's why going to straight to those good resources that we send over typically through like ManyChat or email when someone is commenting, will give them clarity and the right resources to go and learn more.
Are there any other of the top 10 that typically get a lot of questions or engagement? I mean, I have a couple that I'm curious about, but just wondering if there's any other that pop off.
The thing that people were asked most about, that they commented most about with the top 10, definitely like the mammogram.
Sure.
I had already spoken about not wearing underwear to bed. So a good amount of people had started to see that reel, as far as why staying on the top floors of the hotel was the other top thing that people were asking about. So I ended up doing additional content on that and expanding it. And that comes down to the amount of EMFs that you're exposed to on top floors of the hotel because of the towers that they put on top for everyone in the hotel to get service versus lower floors.
Gotcha. And for those who maybe, I know it's not a master class on it, but just high level, like the EMFs and the issues that can cause, do you mind sharing just kind of high level of what that pertains, why some people should be concerned about that?
Yeah, I also have a full highlight on this on social media. A lot of the things that we talk about here, I have more extensive for those that really love to binge and go through. I do have an EMF highlight, as well as ways that you can mitigate EMFs with a lot of different tools and resources out there, so you don't feel powerless when you are exposed to it.
Alyssa? Sorry to cut you off. Is that on your link tree?
It's the highlights that are on my social media.
Oh,
so the highlight bubbles, the little circles for people that
Gotcha.
may not be familiar with that verbiage. But yeah, if you swipe left on that, then you're able to go and check those out. I want to make sure that you can still hear me. I can't see you right now.
That was fun. I just clicked
I
clicked the button to share it, and it bumped me out for a minute.
Okay. So. I was going to say, maybe you're trying to share on the highlight, but yeah, the little circles that you'll see on people's Instagram, you can swipe left on mine and scroll through a bunch of them and you'll find the EMF one.
Yeah. Perfect.
But yeah, so when you're looking at EMFs, ultimately those different types of frequencies that come from all the technology that we're using anymore, outlets, I mean, anything that would be plugged in on Bluetooth, wireless, anything like that, it essentially disrupts the functionality of our cells. One thing that people don't know about EMF, because it seems woo, you can't see it. We know it works. How do you think you're calling someone on the other side of the world? Or that's not like we don't fully wrap our brain around the fact that it's so powerful to be able to do that, but you don't think it's influencing your cells. So when it comes to EMFs, people don't realize that it actually does instigate the toxin or the pathogenic load that you have. So there are studies showing that mycotoxins duplicate faster and have higher activity. So mold that you may have within your system is responsive to EMFs. So people who have mold exposure could be more sensitive to EMFs, have more types of symptoms, such as maybe just very low mitochondrial energy. Their brain fog may be worse. They may have greater gut issues. I mean, it can cause a host of different issues. It also increases parasitic activity. So those are two top things, without going into all the other detail, of things that we work on with clients on a regular basis, where it can make those worse. So that exposure does matter.
Yeah, no, there's so many questions that popped up as you were describing that. Going through, I think I want to transition a little bit into mold, and kind of, because you mentioned how it can respond to those and replicate faster, et cetera. Like, so for those out there, because it's definitely, there's content from clickbait to actual real valuable stuff out there. There's just so much out there about the topic of mold. How or where are most people, exposed to mold? And what are maybe some signs they could look at in their environment, if that's where it's coming, wherever it's coming from? I'm just curious to try to give people some ways to think about it.
Yeah. So when it comes to mold, for me specifically, I was dealing with that chronic fatigue and that brain fog and the recurring like Lyme symptoms that I felt like I couldn't get on top of. So a lot of times that is what I will see with people is they're dealing with these chronic infections they can't seem to get rid of. It could even be something as simple as like a UTI or yeast infection where like they just keep treating it with stuff and maybe it's not that bothersome, but it's annoying, or something more extreme like some of my issues that I had. And so those are the ones that we most commonly see, but you may have some people that also just feel like, oh, my word recall is a bit slower, or like, why am I forgetting a conversation that I feel like I just had with my husband or my wife, or like you end up having that, I'm just thinking of a meme that I've seen with like word recall where like it's a hummingbird and someone's trying to describe it and they're like, that flying midget thing. And that's what you kind of do, right? Like you're like, it's a simple word. I should be able to look at it and be able to say what it is or recall it quickly. And so those are common things that tend to like exacerbate over time. And then eventually someone's like, okay, this is not going away and this is not normal. Why am I here? And what is going on? And then you may have some people that it's like rashes or acne or something that shows up for them. Hormone imbalances, especially for women, are big issues. So those are just some of the most common ones that we see. As far as what someone may end up wanting to look at, like within their home, if they're like, hey, I think I may have mold in my home, even if it doesn't smell mildewy or musty, it's something that I anticipate. I mean, there's an estimated at least 50% of buildings in the US, commercial and residential, have water damage within them, right? Contributing to mold. But you want to check for things like your AC units, the HVAC system, your bathroom vents, inside chimneys, your washing machine, especially like rubber seals, especially like underneath sinks, closets, attics, crawl spaces, basements, your windowsills, the toilets, your dishwasher that will end up having stuff built up in there, in cabinets. And so a lot of times conversation we're having with clients is, have you ever had a leak in your house? You may not think you have mold, but if you had a small leak, you absolutely could have. I have clients in new builds. They're like, my house was just built. And I've seen this over and over again. I've heard this story over and over again. And with the way that they're making homes anymore, a ton of new builds have mold. So you can't count it out. So a lot of times we'll go and do a simple test called an ERMI, maybe to start. It's like a little Swiffer dust test, or you can definitely do more extensive testing in all areas throughout the home, do like pinhole cameras, go behind walls and be able to test there. There's air sampling, there's actual dust sampling. There's so many different methods to be able to assess.
And I would imagine that like if someone has it in their home, let's say, I would imagine that has to be addressed as part of would you say like right away, so that your therapy or your whatever interventions you're doing, it's just not resurfacing? Is that
ideally? And the reason, if you remember when we were talking about like that roadmap to health, I'm like, we get drainage pathways open and then mold and parasites are often what we address first. It's because of how they impact the immune system. And mold suppresses both Th1 and Th2 branches of the immune system. So it's kind of like all bets are off. Like you do not function well if you're constantly living in that threat. But some clients don't have the financial means to be able to maybe do remediation, even if they do the testing and they find that it's an issue. So sometimes we have to be creative. How do we go and stay on top of keeping that load as low as possible? Is it so threatening that they have to get out now? Or can we find a happy medium? Are they in the middle of a lease and they cannot get out, and landlords, 9 out of 10 of them, are not going to even believe you or want to address this? I got lucky and had a friend as a landlord that remediated my home there. But you may end up needing to stay somewhere else for a bit, stay with family members, stay in a different room. Some of my clients have found just their bedroom was the moldiest thing. So they were at least a little bit relieved if they slept on the couch in the living room. So you find the balance and you figure out what makes the most sense for you and your family and in what timeline.
And if someone finds this might be out of your scope or comfort level, so feel free to redirect if needed, but someone finds some visible mold, they don't have the resources, or they're just like, I just want to address something right now to like peace of mind. It's going to take me a month or two to address this. Are there any low cost ways to mitigate some of it? And if you can see it or you kind of know where the source is, or is it just best to just not touch it, leave it to the professionals? Of course,
My
the
go-to
second's
is
gonna
it's
be
best to not
obviously.
touch it and leave it to the professionals, because
Okay.
you're going to, until you fully assessed the home and made sure you did it the right way, you could instigate and spread it further. However,
Yeah.
I mean, there are certain mold consultants that we may refer out to, so that like all they do is mold and say, hey, they're going to look at your situation and give you the best recommendation there. We may feel, depending on the situation, okay with giving the recommendation of, hey, here is if it's a minor mold issue, maybe here is the solution to kind of clean things up. If they're that sick though, they should not be doing it. Like someone
Yeah.
else needs to be doing it, ideally wearing a respirator, doing all of that. But a lot of
Right.
the recommendations that we give in our moldy home guide to our clients is the particular type of like HEPA bagged vacuum to use to make sure you're not circulating it throughout the house, to make sure that you're going and washing different items in your home with different solutions that can pull mycotoxins out of the fibers if it's something that can be washed. Going and making sure that you are like wet dusting every week to be able to get any of that has kind of settled in the dust. Those are the little things that we will look at. Good quality air purifiers that filter down low enough to be able to actually get mycotoxins out of the air. That's what we typically do as immediate steps. And then talk about, because it may not be like in a month or two, Joe. It could end up being, listen, we've assessed this and I can't do anything about this for 6 months.
Yeah.
Some people can spend 30, 50 grand is not unheard of for a mold
Right.
remediation, depending on how
Yeah.
severe it is. And a lot of times it's still done wrong when you don't do it with the right person. So it's definitely an undertaking.
No, I know personally, and then even others I know where they had a very minor, like, leak in their roof, and then all of a
Yeah.
sudden, in the corner of the roof is mold, and then it's showing up in the bathroom or whatever
Yes.
along the vents, and then it's like, oh, well, so I can clean what I can see, but if you go up there, it's all the vents is just
Yeah.
pulling that and circulating.
Yes.
Yeah, so fun
Yeah.
stuff.
Yeah.
Well, and I had a family member, and again, I know there's some nuance to this, but I wanna say she had to do she was on like some kind of mold protocol for, I wanna say almost maybe a year, maybe a little longer, because it was a
Could have
really
been. Mm-hmm.
it was at the church she worked at, and the one wing was just, I guess,
Yes.
whatever this means, but really, really bad. So,
Yes. Yeah.
yeah, and just like you said, just all the above, just didn't want to get up, was trying to also lose weight, get healthy, all that good stuff, but just was like constantly uh up and down, constant brain fog, no motivation, hard time focus, lots of caffeine every day to try to like power through stuff.
Yeah.
I'm sure I'm missing several of the other symptoms, but um yeah, so it can be a lengthy journey for a lot of people too out there, I would imagine, that you're working with, as far as walking them through, at least in their body, getting it out as well. Is that tend to see pretty long time frame? Does it depend on the exposure or the type, or
Can depend on the exposure, can depend on the type, can also greatly depend on like how quickly they can get out of the environment, and how regulated is their nervous system. Mold is a huge nervous system dysregulator. So there could even be people that get out of the home and they go through these protocols. And it's like, why am I still insanely responsive anytime I'm even in contact with mold somewhere? I know people like that in this space. And they have not retrained their limbic system to not respond to mold as a threat, because we're all exposed to it. So
yeah,
they kind of still almost feel like they have to live in this bubble, or they're still really limited, or they never fully recover to begin with, because the nervous system is still responding as if it is being exposed to it. Or when it is exposed, it's like adding insult to injury. So that is a huge component. And it could be, we do typically like a more full spectrum approach to nervous system regulation. There's countless different programs that are out there. Someone could say, I meditate, I pray, I do breath work, I do somatics, I do EFT tapping. There's so many different types of approaches. We like to equip clients with a program where they're going to get to experience all of those tools and know how to strategically use them throughout their healing, because that's what I found works best. When you get stuck on just one tool, I oftentimes see that you're capped with that, because
yeah.
that's just not how the body works.
Got it. And then what is the mechanism primarily, I guess, or maybe mechanisms, if there's a couple top ones that mold is causing these issues? Like, like when you mentioned like hormone issues, brain fog,
Mhm.
focus, energy, etc.,
Yeah.
mood shifts, is a lot of it tied to inflammation? Is there like, what are some of the key things
Yeah.
that are causing these issues?
So when it comes to mold and all the compounding issues that happen, the mechanisms that are taking place are clearly varying. One of the top ones that we talked about earlier was two major branches of the immune system with the Th1 and Th2 are suppressed, right? So every other infection, everything else that your body is
Uh,
trying to just address on a daily basis becomes a bigger battle when the immune system is suppressed. You have many molds that can be estrogen mimicking. Literally, they attach to estrogen receptors. So you have all these women
mm,
with estrogen dominance, PMS, PMDD, all these women that are having more issues with endometriosis, needing to get ablations, needing to get hysterectomies, dealing with infertility, so many different, or even amenorrhea. Some people that don't even have cycles. A lot of people can deal with hormone issues, but especially women when it comes to mold. When you're looking at gut issues, mold can colonize in the gut and lead to a lot of food sensitivities, allergies, that leaky gut, creating
yeah.
the environment for
Right.
parasites to be there and H.
Mm,
pylori to overgrow and candida to overgrow. And then when you're looking at the overall drainage effect, liver gets super stagnant from mold. So bile in your liver gallbladder that you need to properly detox, to get rid of estrogen metabolites, to properly be able to kind of digest food, to scrub the gut and kind of just like get things out of the body, that's really impaired. It's super sludgy. It's slow. And so then when that's backed up, when drainage is backed up, everything else gets worse. So those are just a couple of examples of the top ways that we see mold really impacting the chronic symptoms in our clients.
no, and that makes a lot of sense, because I would I've heard of many cases where someone had H. pylori, SIBO, etc., these
Mhm.
different things, and they're cured, but then however much, a little bit of time, but not
Yeah.
too far off, all of a sudden it pops back up, and there wasn't like a major change that caused it. So it seems reasonable that, okay, you killed off that issue, that bad bacteria, whatever, but the root is still there. Just it's just going to rebuild and just grow back. Maybe got some relief for maybe
Yes.
hopefully a year or two, maybe even long, maybe a nice little
Sometimes
break,
not even that long.
but usually not as long, right? It's usually
Yes.
like, oh, I felt good for a little bit, now I go back to feeling like crap. So
Yes.
no, and that yeah, because that's depending on the practitioner. Obviously, as I've already mentioned, you have tons of great resources, good information to where really getting in the details with your clients. But and I'm sure there's a lot of other well-intended people out there, but I've seen many that invest a lot of energy, effort, and money into these protocols, and again, best of intentions, and it does give relief for some time, but then it comes back. So I think
Yeah.
what I'm hearing is like, we really got to look at where did it come from, and so on, which leads me to my curiosity on like, well, because you mentioned the other earlier about testing. So
Mhm.
do you what do you do to best think someone's done, if you will, with a protocol? Is it a follow-up test? Is it, hey, we're going to check in every 3 months, 6 months on your
Yeah.
symptoms, or questionnaires, or what? Yeah, what do you do there?
Yeah. I mean, I'm sure as you would imagine, of course, this is going to be bio-individualized to the client.
Yeah.
But when we're looking at testing in general, clearly we know from the beginning how severe something is based off of their case history and their labs. And so we may end up getting, I would say before I want to redo testing for most people, it's at least 6 months. We don't make someone work with us that long if they don't want to, but I like to set the expectation because most people coming to us have been dealing with their stuff for years, if not decades. And I want to be crystal clear. We're not eradicating most things in a month, 2 months, 3 months, like completely. Some things absolutely may be gone, but typically not all symptoms are fully eradicated within just a couple of months with how long that they have been experiencing them. So we will make it on a decision by decision basis per client and say, maybe we'll just rerun the blood work, maybe just specific panels to be able to evaluate. A lot of times we go off of symptoms, but we want to be able to look at labs, at least blood work. Sometimes we'll rerun a functional lab as well, depending on what the preference is and the financial ability of the client. We'll do the best that we can. But some people can still feel like garbage and still see their labs improving because they've just been dealing with this for so long that even just getting white blood cells from a 3.4 to like a 3.8 or a 4 was like such a huge win. Like their overall immune function is so much higher, or we have other levels that we were able to greatly improve, and they can see and conceptualize, okay, I'm not where I want to be yet physicality wise, but I can see that we're heading in the right direction. And then maybe we'll change the cadence and we'll say, hey, now at this point, do you feel comfortable? And do we feel comfortable and confident saying, let's meet once every 3 months or once every 6 months? And typically we're working with someone very hands-on within the first couple of months, where they have daily, what we call like practitioner in your pocket level of support, where they have direct chat access to us Monday through Friday, because we're fielding different issues and symptoms, and there's accountability and nervous system support and all the things that we give for someone for several months before they're kind of more, not self-navigating, but more independent, where they're given their protocol and they know how to be able to respond if they have some type of detox symptom or they need to adjust something. So we equip them that they can be their own best practitioner and navigator moving forward, but it doesn't start off like that.
Okay. No, it's great, because whenever you start explaining something, the 2 or 3 questions I had from the last thing you explained are wiped out and replaced with new ones. So I did, yeah. So that's really helpful. I think one of the things I wanted to understand a little bit more is, like, as far as myths go, like there's a lot of stuff out there, and a grab bag of whatever you'd like to pick, if you want to stay broad with like women's health or with midlife health or specific to toxins, mold, detoxification. There's just all of the above. I'm just wondering if you could maybe share out there, like, what are your top maybe 2 to 3 myths or misunderstandings that people are coming into these consultations with, for those listening, just to kind of help provide some clarity from an expert on what's actually the truth.
I love that question. You got my brain spinning. So some of the top myths that I think some people come into our clinic with that I would love to clear up immediately would end up being that parasites can only be gotten if you've gone to an underprivileged or third world country, that Candida or H. pylori or EBV or Lyme or other infections are, let's just chase the infection versus addressing the terrain. That when you're looking at breast health, like we talked about earlier, mammograms are the gold standard for breast imaging, and that should first be done and nothing else really matters. Those would be my top 3. I could probably sit and kind of think and spin a little bit more. I know you just kind of pulled that one out. That wasn't something I got a chance to think about beforehand, but I'd say some of those are some of the most top misconceptions that are out there.
Yeah, no, I appreciate that. And if you were to conversely, like, what are maybe the top like 2 or 3 things you would hope that everyone out there or someone listening to this practical should know or understand on these topics? Like, are there a couple things that come to mind that you think of, conversely to like what are myths, but what are like hard truths or good things that they should know or walk away with?
I think some gold standards that for good quality health that I would want everyone to know, but that these things aren't very commonly talked about, is that everyone should be parasite cleansing at least 2 to 4 times a year. Hands down, other cultures do it. We do it with our animals, but for us, we feel like we're not supposed to. And it's one of the most life-changing things for overall immune modulation, as well as getting rid of harbored toxins, pathogens in the body. And then also the fact that water and air purification should really be a non-negotiable. They are some of the biggest things that you have influence over. You cannot rely on just a standard AC unit and regular HEPA, if they even call it that, in your unit to filter furnace filter does not count. And the filter that you think maybe your tap water is going through, or the cleanliness you think is happening with your tap water is not enough, and neither is your Brita or probably other pitcher that you're using. You need to purify your air, purify your water, and those are 2 huge ways that you will drastically reduce your overall toxic load, and you're consuming those things anyway. So that would be a priority.
For water, just curious, is reverse osmosis good enough? That type of system, is that a good one? Or is there other ones maybe that do work? I'm just curious to what, like, I
Yeah.
think, oh, sorry, go ahead.
When it comes to water, we have a free water guide that goes
Okay.
into all of this that was built off of the information that's also in our water highlight on social media. Go through that because I talk about all the different types of filtration and what you even want to look out for when companies claim that they filter out XYZ contaminant to a certain percent. And they can kind of dupe you with the way that those tests are done. You have to be really logical about it. So go through that highlight. You would really enjoy that. Reverse osmosis and distilled are going to be my top 2 recommendations. There is a lot of debate, even in the functional space, about best form of water filtration, and everyone can choose their own filter based off of the quality of their water. The reality is that whether it's municipal or whether it's well water, it's changing all the time as far as the different contents that may get into that. So I like to, across the board, have clients do at least reverse osmosis water. And some clients, I will say, if you're open to doing distilled, or immediately if you have radioactive elements in your water, you need to do distilled. The top things that I'm concerned about that would make me say, I really want you to do distilled water, is if you're going to have something like uranium, radium in your water, so radioactive elements, especially in like California, in Pennsylvania is really huge ones. There's a lot of different states that can have radioactive elements that get into the water supply, but you want to make sure that those are fully pulled out, and the distillation is going to be the best way to remove all of those radioactive isotopes. Then if someone doesn't have that and they don't have insanely high levels of like pesticides and herbicides in their water, which a lot of times those get through glyphosate, atrazine, a lot of times just wear down in like the filtration membranes of some of these other filtration mechanisms. It's just the load starts to get higher. I would say go ahead and do distilled, but next tier down would be the reverse osmosis. So it can depend on the client. I typically would pick one of those 2. There are some decent, like Mountain Valley spring water is, a decent one that I've seen with some other testing as far as the spring water debate. But what I'm most concerned about with water filtration is I want you to purify it, and then you can restructure it, and then you can remineralize it. So when people say, don't do reverse osmosis, don't do distilled, you're stripping it of all of its healing properties and all the minerals. You can add that stuff back in. I'd rather get rid of the radioactive elements and the pesticides that are lingering in some of the other water filtration approaches, or that may not be filtered out. With something like spring water, you can still have radioactive elements in that. So I would rather clients just have the peace of mind, wipe all that stuff out, add all of those good properties back in, and know that you're drinking good, pure water.
Yeah, it's I want to say because we're on well water, but they recently ran a city line through. So would you, and we use a reverse system. I want to say it's arsenic is in the water. Our wells here are pretty high. My question too would be, when you're talking about these methods with water, how do I want to phrase this? So is it kind of definitely make sure you're doing this with the drinking water, and if you can afford or have the means to do it with bathing, et cetera, like the other water you're using,
Yes.
would you prioritize, one of the, I'm assuming drinking water first, and then if they can.
1,000%. We talk about that in the water guide because many people will be like, oh my gosh, I'll just get a whole house filtration system and that's going to be so much better, right? Like I'm covering all of my bases when I'm showering, when I'm brushing my teeth, what I'm like cooking with. You could still do that with like the drinking water stuff. It just kind of depends on like how big your household is and how much is available. And so people are thinking volume and sources of exposure. So when it comes to whole house filtration, could you technically wire it so that you could do whole house distilled? Technically, you could. It would be insanely expensive.
Right.
But I know someone that does that with certain areas of their home. They're not showering with distilled water. That would be an insane chamber. I don't know of anyone that has done that. Reverse osmosis is a little bit more likely. I do know people that have these huge storage tanks of reverse osmosis, especially those in Florida, where they may be out from hurricanes and they want to have this huge supply. So it's possible. But most people, when they're getting whole house filtration, it's going to be a whole house carbon tank. That is not going to be anywhere close to reverse osmosis or distilled. So yes, purifying your drinking water, and that includes your ice cubes. that you would use that includes what you are cooking with because it's getting into your food. And then if you're able to do a shower head filter alone or a whole house system or even a bath filter for your kiddos, they have those too. That would be the runner up if you couldn't do a whole house after that.
Yeah. Yeah. No, we noticed a difference in there's some other things that my wife did that I know there are a lot of little things we did, but definitely had a lot of issues with like eczema and skin when they were infants,
Yeah.
so that was tough because that was a lot due to I think primarily due to the water and such, but no, and so is there anything else on the topic of water? Because I had a couple other areas I wanted just to touch in. Anything else that comes to mind before I transition to a couple other questions I had?
No, just make sure that you're doing reverse osmosis or distilled water.
Well, I did have one other. Are there any? I'm sure you have a guide and resource that I'll point people to, but I have to ask still. So, like you mentioned, air filters. So, I was telling you someone else I had on a while back about mold and stuff. When I went out and was like, my wife was telling me this for a while, and I'm like, yeah, we'll get it eventually after the podcast. But did you ever order those air filters? Because we got a bunch of extra ones. Because I'm a guy. So sometimes we're a little boneheaded. It takes a little bit longer for us to come around to these things. But as far as with the your furnace or those types, are there things someone could look for buying like your I don't know another way to phrase it, but like traditional filters versus like adding? I mean, obviously adding them would be helpful, but are there certain brands or certain types of filters or tips that someone should be looking for to upgrade maybe their general filtration of air in their household?
I mean, you want to get a HEPA that filters down as low as possible.
Yeah.
So that's the best general recommendation that I can give. It's just not going to get anywhere near as comprehensive as going and doing these units that there's so many good companies that are out there anymore. I would want to try and make sure, like for those units, they'll filter down to like 0.007 microns. When you're looking at filtering out viruses or mycotoxin spores or things like that, that's what you want. So getting as best as you can if you're going to go ahead and do that. But when it comes down to some of these companies that'll be like, oh yeah, the UV light, that's actually better and it filters everything. We've literally seen mold growing on the UV lamps in some of these systems. So a lot of people are just sold these whole house systems that they're just not anywhere close to these portable units that you can
Got
get.
it.
So
that makes sense.
Yeah.
Well, and I think if someone had, I'm just thinking back to earlier what we were talking about, if someone had a room that was somewhat enclosed, and had some mold exposure that they couldn't address, maybe that would be one line of defense is to add.
It would be a
that
non-negotiable for sure.
Yeah.
Yes.
Yeah.
Yes.
Okay. Makes sense. One of the other questions I had are topics that I'm sure there could be a whole podcast on this, but you had some really good content explaining like spike proteins, and some things along those lines that you've put out there.
Mm-hmm.
Curious for those who don't know much about like what is a spike protein, where does it come from, all that good stuff. Maybe just a 10,000-foot view of spike protein.
For sure. I mean, I think a lot of people know that COVID happened, right? So anyone that either got COVID, was exposed to COVID, or even if they didn't test positive for it, you were exposed or you ended up getting the vaccine or a combination of those. We have the spike protein. So Dr. Peter McCullough talks about this a lot. He's been a huge advocate for this as far as really pioneering the research and figuring out exactly what components can help degrade the spike protein because of the amount of issues that it has caused since 2020 and the increase in deaths from people that are vaccinated because they have such a high spike protein exposure. So it was the component that was part of COVID. Like that was the spike protein. That was the mechanism. So when you're looking at it being something that you just got as an infection, or you got vaccinated or someone else got vaccinated and it can shed through sweat, through saliva, etc., this is a threat to the system. And so when we're looking at the ways to be able to degrade it, there are absolutely formulas that they've found with a certain concoction of ingredients that help to break that down between proteolytic enzymes and some other components that are in there too. So I have been speaking about it more lately because we see it in our clinic, all the time, as far as a lot of people were forced to either get vaccinated or they did it before they knew any different, or they never were, and they still have long COVID issues. So a lot of people had coexisting like issues beforehand. Then they have the COVID on top of it, and it added insult to injury. And then now we're having all these long issues, right? So when it comes to incorporating that into client protocols, we may do it for, at least a month. If someone has like long COVID, I'm typically seeing for like at least 3 months. If someone got vaccinated, I'm like, I want you to be on this for 6 months plus. And it depends on how severe their symptoms are. But that way we can go ahead and start to degrade that.
Okay. No, good. Yeah. And as I mentioned, just for everybody out there, we'll have all this in the show notes, but there's a lot of good posts and, as Alyssa was saying, if you comment on those posts, there's guides that they'll push out or in the highlights or link tree as well. So we'll be sure to point you guys to that because if Alyssa had, 6 hours, maybe we can get into it more, but I don't think she'll be signing up for that today, nor do you maybe want to listen to me ramble for 6 hours and guide us through these questions. But I did want to get to some general kind of your take on things like, blue light or, the blockers relative to like screen time and things. And then I have another question about some of the light therapies, but I was curious to like, is that something you see as there's some utility there, practical, and it helps, or, as far as like blocking screen time, glasses for that, things like that?
I mean, yeah, light can be inhibitory or it can be very rejuvenating. I literally have my red light underneath here, and if it wouldn't have messed up how I would look on the screen, I would have it going. I typically do have that at my standing desk every day. So I do like to leverage red light. As far as blue light goes, it's not necessarily like a bad thing, demonize it. Like you can never be exposed to it. You have to wear blue light blockers all the time, but especially for people that are a little bit more sensitive, their nervous systems can be way more stimulated by it. So with the amount that we're exposed to it on our phones, on our screens, especially depending on your job, I do think it's smart to be wearing like a qualified blue light blocker throughout the day if you can. And you can take breaks from them, but I think it's smart. You can go ahead and do something that's a little bit of a deeper red more at night. It definitely does help to make you more tired, calm your nervous system down. So I do think it is a very smart tool and it's definitely relevant, but there's also a lot of dupe glasses out there. So you need to pick ones that have been third-party studied and verified to actually filter out that light, not just like yellow or red tinted glasses. It is different.
And on these glasses, I would imagine, is there like a level, like, hey, this blocks this level of this light, so you kind of know which one these third-party tests, like the strength?
Well, different websites will end up saying different things. So you just go and look for, like, ask for their studies and see what it's verifying that it filters out.
Gotcha. Yeah, no, just someone like myself, even who, oh, that's a good idea. Like I did some surface level research and I ordered some, I noticed a difference, but after you just mentioning that, it's something I'll take a second look at, is just like, how valid are they? Is it placebo? I don't know.
How much of it is it actually filtering out? Maybe some, but not all, depending on the quality of the lenses. Yeah.
Yeah. I notice it seems to be helping at night because we're definitely like the fall asleep to noise type family. And sometimes that'll be the TV or, it's the typical, addiction type thing where you're just reaching for that phone and it's like, man, I wasn't going to grab that for the next 2 or 3 hours. Why'd I glance at it again? But having those on seems to kind of help. What are some things you found in the either application or in the literature that made it, such a daily addition to what you do for red light therapy? Because I'm learning more about that, but I'm still kind of trying to understand it a little bit more and how it works. But can you mind sharing a little bit about that?
Yeah, I mean, it's such an extensive topic. I have a highlight, I believe, on this as well, where I talk about some of those things because there's just so much research on it and people have no idea. So you could just go to ChatGPT and ask it to bullet point the top 20 benefits of red light therapy and please pull peer-reviewed or clinical studies. And you always have to verify stuff that you see on ChatGPT, but it's a great tool that people just don't think about using just to be able to get some simple information and make it a lot easier on yourself than sorting through Google. So that's what I would recommend. But yeah, I've done reels and posts on things in the past. Specifically, mitochondrial support is what I want to use it for. I actually really do love to pair it with methylene blue because it's a photoactive dye, right? That'll be able to enhance the benefit that you get from red light. So you have like they used to call it like red light and blue. That was a big thing that went around a couple of years ago as far as a protocol, but it's just one of the most powerful tools that you can have. And when you need mitochondrial energy to be able to actually detox and drainage pathways function and do all the things, it's a really simple tool. And I definitely am not a winter person. So it changes my mood drastically to have that light exposure. Even if I could get outside and take a walk when it's light, and if I'm bundled up to here and this is all I'm getting it, like my body's missing out on what it needs to be able to function. So.
Yeah. And you mentioned methylene blue. Is that when you're doing that, is it, when you take it and there's a certain amount of time you would be exposed to it? Or is it just, hey, I'm doing a methylene blue protocol and I just happen to have a red light exposure every day?
Yeah. Typically they say like you'll take methylene blue within like 30 to 90 minutes. People will give you different time frames, like 30 to 90 minutes, try and be in front of red light if you can. And that could be like early morning sun or evening sun. There is red light at those times of day just from the sun. But when you're going and having the consistency of a panel, especially in the colder months, it does make a big difference.
Yeah. Yeah. No, I saw one of your post on the highlight there. You had the big, like full length panel you use. And cool.
Yeah.
Good stuff.
Definitely want to be able to look at, and I do believe I talk about that in my red light highlight as well, but there's, $50 panels that you can get on Amazon that are like red light panels that you always want to look for third-party studies. You want to look at like what frequencies do you want? This one has far and near infrared. A lot of saunas have red light. So, what is it in there? So you want to double check those things.
Well, we've talked a lot about your Instagram, but as we kind of wind down here and resources, if you wouldn't mind, I'd like to navigate just for the viewers out there, a few of your resources. And then, those of you on audio, as I mentioned, this will be in the show notes. Because not only, I think a couple things we've highlighted, is where to find you with Instagram, and we'll definitely get all of your socials in a moment here, but all your highlights as you were talking about. And then as far as your link tree, so we, just for those listening, we have, coaching, targeted plans and protocols, cellular activators and stacks, supplements and dispensary, EMF protection. So these are these, I'm assuming, of course, I'm just going to say it for those who maybe aren't seeing this, these would be like companies you vetted and you recommend?
Yes, we're actually working on putting all of these on the Shop My account that we have, because before that was a thing, everyone just used Linktree, or you had it on your website, but this was just easier for people to navigate. But for anyone that is just listening and not seeing this, we have a ton in our Linktree, like a ton. Anything that we had talked about, we could say it was in the Linktree and you guys could scroll and find it. But if we ever talk about something and you're not sure where to find it, you can always go ahead and shoot us a message. And my team is great at getting back to messages on a daily basis, Monday through Friday, to be able to help give you some answers.
Yeah. I just set up a Shop Me myself recently, so I haven't played with it yet, but yeah, it sounds like that's going to have some good value for you. And
for sure.
Years. Yeah.
Yep.
I'll have to play with that a little bit. And then your site. So you have, obviously about products, etc., different, so are these, you have like a masterclass, breakthrough session? Can you tell just the audience a little bit about what's on your site there that people can?
So 3 major resources that people often start with that are on our site are, number one, if they're wanting to learn a little bit more about drainage, which is like that first step in being able to open up those pathways and do deeper detox. We have an on-demand 3-day or 3 training drainage clinic that just dives deep into so many of those topics. It is giving you specific protocol examples. It's helping you to understand even what lab markers that you could look at that could indicate drainage stagnancy. So super, super helpful. And that just became free again. It was a paid option beforehand. And I was like, I just really want to just be able to like unload this on people. So many people need this. So that is something that is free. The Parasite Masterclass that we have is free. So if someone's like, I know I need a parasite cleanse, It is a very detailed masterclass, as well as our detailed detox guide that is paired with it. So that will give you all the instructions to parasite cleanse on your own if you would like. Or if you're someone that's like, I am honestly tired of this like self-navigation nation side of things. I really just want to link arms with a practitioner so they can tell me exactly what to do and how to do it. And I don't want to have to think about any of that, nor am I seeing success navigating on my own, whatever it may be. You can schedule a free breakthrough session with my team so we can talk a little bit more about your case, some of the gaps that we're identifying that are within your healing. Like, what does it look like you've missed or what hasn't been done correctly? And then how could we support you moving forward? There's no obligation to move forward after that with us, but it's more for someone that's considering working with our clinic one-on-one and discussing options.
Oh, that's great. That's
Yeah.
awesome. Yeah, a lot of good stuff there. And you mentioned, because like the parasite stuff, you mentioned twice a year we should be doing a cleanse minimum.
Oh, that's at least. Like, I would
At
say, honestly, like once a quarter is really good. Like, think seasonally, like going and doing at least like a 7-day full moon cleanse around there, which I teach you in the detox guide that goes along with the parasite masterclass. But whenever I'm working with clients and we're addressing parasites, that's going to be something that we're typically addressing for like at least 8 weeks together in some way, shape, or form. Various different parasites, different types of formulas that hit on different ones, address different life cycles so that we can really pull down on that parasitic load. But as an ongoing maintenance practice, once a quarter is great.
Yeah, that's such a great point that you made about how we do with our pets. But like, we've never done in our household, but we do with our
Yeah.
pets at least, yeah, I don't even know, several times a year, pretty frequent. So
Yeah.
wow.
And you're touching them or they're sleeping with you or they're on your couch or they're on your carpet. And then like you're picking this stuff up and we just don't think about it like that.
They're only on the couch when the 10-year-old is alone. So, but yes.
They're walking on your same floors, whether they're on the couch
I know.
or not, right?
Yeah. We're exposed. It's
Yeah.
just funny because I'll walk upstairs, I'll hear some ruffling around. I'm like, were the dogs on the furniture again, Bray? So, well, thanks so much for joining us today. A lot of great information. Definitely barely scratched the surface. So I would encourage everybody out there. By the way, great username, Biohacking Bombshell. That's awesome. So how can people forget that, right? So that's catchy. But check it out, because it's a lot of. I encourage everybody out there to check out, at a minimum, our Instagram and go through those highlights, and then obviously you'll probably will get sucked into all the great resources. So, and it'll navigate you from there. But thanks so much for coming on.
Thank you for having me.
Yeah, we appreciate it. So for everybody out there, be sure to like, comments, share, all that good stuff that helps both the audio and the YouTube performance of the podcast. That helps us get more great guests like Alyssa. And if you have any questions, feel free to shoot them over. We will gladly connect you directly with Alyssa and her team to get answers to your questions and point in the right direction to her resources and guides as well. So thanks again for tuning in, everybody. We'll see you guys. Take care.